114 is the latest number of COVID-19 cases reported in India, much lesser than numbers reported around the world. Now, many are touting this as testimony to some sort of better management of the crisis by India. And yes, in some things we are ahead of the curve, like restricting travelers into the country, social distancing, etc. But is there more to this number? Do we have fewer numbers because we're just testing too less? This is a question that countries around the world are asking themselves, including the United States. Who do you test? Do you restrict it to just those who have symptoms and have traveled? So sample this. India has tested about 6,800 people for COVID-19 between 30th Jan and 16th March. That's approximately 3 people per million. Up until 9th of March, South Korea has tested over 2 lakh people, the UK 26,000, France nearly 12,000, and so on and so forth. Clearly, the more people you test, the higher numbers you have. It is a function of the data, which is why it is important to ask, are we testing enough? Is social distancing alone going to do the trick? Because that seems to be our biggest weapon right now to halt the COVID-19. To speak on this, I am joined today by K. Srinath Reddy, President of the Public Health Foundation of India, S.P. Kalantri, Professor at MGIMS, and Dr. Ashok Mahashur, Department of Chest Medicine at PD Hinduja Hospital. Welcome to all of you, and thank you so much for speaking with us. Dr. Reddy, let me begin by taking that question that I've asked to you first. Do we need to test more? And yes, these are questions that governments the world over are asking of themselves and are being asked by their citizens. Are our testing numbers too less?
Well, our testing strategy has to be decided upon the stage of the epidemic as it evolves in India and our response strategy as well. In the initial stage, the first priority was to try and prevent people coming in with the virus, whether as cases or as asymptomatic carriers, but with a compromised travel history of exposure abroad. And then look at their contacts within India and try and isolate them as quickly as possible so that you don't have a spillage into the community. And that is the strategy that was followed initially. Subsequently, as the number of cases who are coming into contact with some of the infected persons is increasing, I think more people are being tested, but on the basis of clinical criteria or on the basis of travel history, as I said, because you cannot have mass screening, you cannot have indiscriminate testing, but certainly the amount of testing has to increase based upon a high index of clinical suspicion, and that is going to be ramped up over in stages. Because if you start testing indiscriminately, firstly, you're not going to get much of an yield. Secondly, there is no guarantee that somebody who tests negative today is going to be remaining negative over the next 1 year if he or she gets exposed 2 or 3 weeks or a month later. So I think immediately prioritization of who needs to be tested based on clinical protocols. Previously it was travel history, now it will be clinical protocols, and that is evolving as the epidemic evolves.
Dr. Ashok, Mr. Reddy makes the point that not everyone can be tested in a country as vast as ours. But is that really the case, considering we don't want to land up in a position that Italy is in today? Do you think we need to widen the scope of testing? Because the more people you test, the clearer you will be as per the spread of the disease.
Well, the testing itself has some limitations. If we test within 2 to 3 days, we may not get the result positive. Therefore, any person who is at risk and has symptoms which strongly suggest the possibility of COVA virus, I think they should be immediately offered the treatment, and protocol-wise they could be sent to a facility to isolate, etc. So it's the suspicion and the history which is going to play a major role. It may be very difficult to have so many centers to test these people and waste the time on that. Testing is important, but if it is not possible, it's very useful to have a proper history and start the treatment at the earliest.
You know, in the absence of widespread testing, do you think social distancing will work? And what do you make of the way it's being implemented? I mean, it's now there are norms that say try and work from home as much as you can. Try, and stay away from people. Schools and colleges have been shut. But in reality, are these going to help? Because we are now hearing of clusters where the epidemic is really, spreading across the world. We want to ensure that does not happen in India. That question once again for Dr. Ashok.
Yes, I think that's what is recommended. Social isolation, social distancing in these situations is going to be playing a major role, because as I told you, we are overcrowded. We cannot afford to do testing to all. All symptomatics may not report, may not get facility to report to a doctor. So I think social distancing is a better way. Wherever it is possible, the corporate should ask their employees to work from home, avoid overcrowding in the places. So these measures are definitely going to help to avoid a situation where in a city like Mumbai, the spread, if it occurs, could be very rapid if the precautions are not taken.
Let me go across to Mr. Kalantri. Mr. Kalantri, the question over here is, are we testing enough compared to, countries with other large populations? In terms of per million, our testing levels are pretty low. Could that be one of the reasons that we are seeing relatively low numbers, about 114 in India, which many are putting down to, some kind of superhuman immunity that Indians seem to have? Is it just simply that we're testing lesser than we should be?
I had said earlier, and I would repeat again, that right now our criteria for testing are very restrictive and they need to be broad-based. Look, that we are a country of 1.32 billion and all that we have tested was just a couple of thousands and we detected only a handful of them. If you look at numerator, it is only 110. If it is denominator, it is about 7,000 and we are housing about 1.32 billion people. So it's quite possible that a large number of people who might have this disease have been untested and therefore we have not been able to figure out the true burden of this disease simply because our threshold for testing these individuals is extremely low, isn't it? We are insisting that you test only those individuals who had been abroad in the last 3 weeks or 4 weeks and who have had a close contact with a person proven to have a coronavirus. Now, given the fact that only 7,000 individuals in the country have been tested for coronavirus, it would be nearly impossible to figure out the true burden of the disease. So, a vast proportion of people who are asymptomatic, who have got symptoms, who are seeking health care, who are getting hospitalized, who are in the ICUs with bad pneumonias, are still not tested. So let me tell you that I work in a rural medical school in Sevagram in Maharashtra, where we had a patient who was admitted with a very severe pneumonia, severe enough to require an ICU admission and a mechanical ventilation. And yet, when we had sent the sample to the regional lab refused to test the sample because he had not gone abroad and there was no proven history that he had come in close contact with a corona positive patient. Now, if our criteria are so rigid and so restrictive, I'm afraid that we might be missing a large proportion of not only hospitalized patients, patients in ICU, but even patients who are tapping the doors of public hospitals, rural primary health centers, district hospitals, private healthcare, simply because there are not enough labs, there is not enough infrastructure to test them. And therefore, I strongly feel that our restrictive criteria for testing these individuals must go. We need to be more liberal, we need to open our doors, and we need to figure out the true burden of this disease in our country.
Let me just take that across to Mr. Reddy. Are we too restrictive in our testing? Because we're still assuming this is going to come only from those who've traveled from abroad. Remember, before we sort of made our screening at airports more stringent, a lot of people had already come in. We've seen cases of that. They have been roaming around. It's not going to be possible to track each and every person down. You actually have situation here where people are trying to run away from the hospitals where they are quarantined. Do you think we need to expand that number now?
Well, I said clinical criteria also need to be used, and particularly if there are cases very suggestive of COVID-19 infection, then certainly those clinical criteria should be utilized. But you see, as Chancellor Merkel said, 60 to 70% of Germans could get affected. Even WHO says that a large number across the world could get affected. It's not the question of burden of disease that we are estimating progressively. It is a question of who needs to be isolated and who needs to be treated most energetically. And based on clinical criteria, you can certainly try and decide on who needs to be tested on priority and who needs to be treated on priority. And actually, now the government, I believe, is now planning to bring in also the private labs based upon the kind of kits that are available, which are quality tested and assured. And some of the labs would be brought in, and therefore there would be a network of public and private laboratories. But first things first, try and contain the entry of the virus from outside, try and contain the epidemic that's being spread by their contacts of people who have come in, and then start looking at testing and treating people who are actually presenting with symptoms and signs suggestive of the infection. Indiscriminate testing is not going to help. Mass screening on a large scale is not going to help. It has to be staged increase in the testing capacity. And if it does become a large scale epidemic, then the main strategy would be to treat the sickest cases and to isolate in home quarantine the milder cases. So I think there is too much of emphasis on testing at this point in time as a mass strategy that's not feasible, not likely to be very productive.
Okay, now let's come to the crux of the question and what is bothering everyone. Dr. Ashok, the question is that can we, and we've looked at how this disease has played out, the pandemic has played out in various countries, can we hope to cap off cases around these levels? 100, 200 odd. And my focus and emphasis on testing is because if you don't realize now and early enough, you're going to be stuck with a more grave situation early on. But can we hope to cap off the number of cases with measures that have been taken across states? So with schools and colleges being shut, with malls being shut, with large gatherings being stopped, and all of those measures are pretty stringent. Do you think that would be enough?
Well, it may not be absolutely enough, but it is extremely useful in today's scenario. We do not know the magnitude of the disease and the duration it's going to take. The best way and our efforts should be directed at containment of the spread of virus. And that best can be done to keep a watch on the symptoms, and the symptomatics need to be told to have self-isolation or you can quarantine them in their own homes or rooms, keep them away from public places, and therefore it's very useful to close down the schools, colleges, conferences, etc. A ban on this would definitely be useful in containment of the spread of the virus. And one has to be very aware of the symptoms. So we have to spread a message that any person who gets symptoms with fever and cough, etc., he should immediately approach the doctor and get himself tested and then start the treatment. So therefore, I think keeping a distance, closing these institutes would definitely help in containment of the disease. Now, how much severity it would achieve, the time would tell us. But if we make efforts continuously, I think other countries have definitely controlled the spread of the disease by these measures, and we should also follow that. I am of that opinion today.
Okay, what about, measures of home quarantine and work from home, will these truly help in containment? Let me get Srinath Reddy in on some of these issues, because that seems to be the way that people are going. A complete lockdown, but practically speaking, that doesn't really happen. People are working from home, but they're still in touch with those in their neighborhoods. People are still meeting each other. What is the extent to which we must implement this social distancing? Mr. Reddy?
Well, ideally, wherever it is possible, we should try and practice it. But it's not always possible for every section of our society to do it. We have a fairly large number of people in our informal work sector, and they are unlikely to be staying home because they have to earn their daily wages. They have to travel in public transport. So it is going to be quite problematic to say that everybody should be staying at home or keeping a very safe social distance. Those who can manage to do it, they should do it. Others, unfortunately, may not be able to do it, but we should try and provide them as much opportunities to work without being subjected to very crowded conditions.
Let me just take one last question with Mr. Kalantri on whether this is going to be enough, and how severely should we respond to symptoms that show. The fact is that a lot of symptoms of the coronavirus or the COVID-19 are flu symptoms, are cold cough symptoms, which are extremely common. So they're not taken too seriously by a large number of people. At what point do you press the panic button? Is it sooner than what we were thinking as of last week?
So the kind of medicine that we practice in India is often very imprecise and imperfect. We do not have enough diagnostics which are accurate and precise enough to distinguish viruses from bacteria, whether they are outpatients, whether they are inpatients, or they are even ICU patients. Even in large public hospitals, it is nearly impossible to pinpoint a diagnosis and to find out who the true villain is. Is it an flu virus, an influenza virus? Is it COVID-19? Is it some respiratory syncytial virus? Is it a bacterium? Is it an atypical bacterium? And so on. So most of the times, the diagnoses that we make are imprecise and imperfect. Treatments that we employ are often based on empirical grounds, and therefore, given the lack of proper diagnostics in our country across public hospitals as well as private hospitals, it would be very, very difficult to figure out the true cause of chest symptoms based purely on history.
Well, let's hope we figure this out and sort of streamline the whole process. It seems a little all over the place. The first move was to restrict the number of people who come into India and then quarantine all of them. Now we realize that we can't ask everyone to quarantine themselves at home because we can't trust people to actually do that specifically. Should we now restrict this testing only to those who have a travel history? These are difficult questions that we will face day after day. We hope we do not get to the further stages of this pandemic, that we are here. We don't go as far as Italy has gone and have the problems that some of the other nations are facing that put pressure on our medical system. We hope that time doesn't come. Until then, all we can do is keep a safe distance from each other and of course stay safe, stay hygienic. So thanks to all of you for joining us on the show this evening and answering some of those questions we have. Just want to tell our viewers how we're staying safe right here in the ET Now studios. We make sure we keep our hands safe even as we bring you the news. So that's all the time we have. But before we go, I want to play out for you a clip of a very key interview we did today. One of the top voices to navigate us through the virus scare in the world and domestic markets. So we spoke to Manish Chokhani, director of Inamdar Holdings. So I'm leaving you with some slices of that interview. Thank you for watching.
What you're faced with this time is a panic, and the panic is kind of exacerbated by the fact that computers now rule global markets. We have 80% of all global trading which now takes place with algorithms as well as by computers. And we've spoken in the past, even in your interviews, about the fact that we now have what we would call price agnostic funds. So when money comes into these funds or ETFs, they are basically agnostic and they keep buying the same stocks. So if you'll recall, a couple of months ago, we were finding it odd that 10 or 15 companies were leading the index higher, whereas the rest of the market had been completely decimated. This seems to be the reverse of that now playing out. That if the tick is down, the computers and the algos are going to keep selling, and if the word of panic continues in the West, the computer doesn't know that mathematically this should have been a bottom. It's going to probably just keep selling. So it's interesting times if people have gunpowder, and if they are not leveraged. I would just urge, obviously don't go and invest your last dollar today. Wait for that one uptick. But at some point, these valuations will be so mouth-watering that a lot of the wealth creation that people hope for will actually occur in these times from the bottoms that we are hopefully creating as we speak.
Sure, that's in retrospect, Manish, and I hope that a few months down the line we'll be like, wow, what an opportunity that was, and this too shall pass eventually. But just staring at the screen right now, many are saying that the high global debt that the US companies are sitting on was waiting to meet with an incident like this, and the coronavirus has given it that opportunity for this bubble to burst. Do you think the panic has just about begun when it comes to some of those US sought-after FANG names and those high market cap companies?
So Aisha, I don't think it's right to generalize. I've been one of the people who've been speaking a lot about the global indebtedness, and the fact of the matter is that the world is running on a debt to GDP of close to 3.5 times, and that debt levels are unsustainable. Having said that, companies, which is what we are focused on when you have to buy them, and you always bet on the fact that mankind will survive. This is not an extinction level event. And if you looked at the companies in the US, whether it's the leading FANG stocks which are generating cash by the bucket load, or you even look like at someone like Berkshire Hathaway, which last when was reported was close to $130 billion of cash. So it's not like everyone is indebted. Similarly, if you turn back to India, it's not like all investors here, including ourselves, had any leverage. In fact, a lot of us were sitting on substantial amounts of cash, not anticipating this event, but just generally because there was nothing very interesting to do given the prices in the market. So I think you will find, water will find its own level. And in times like this, when daily wage earners or the marginal companies don't have access to, cash flows or liquidity, it's not unusual to find that, 10-15% of the bottom rung will get eliminated. And that's really what the governments in the West are panicking about, because that's how, say, Hong Kong is sending $10,000 to per citizen. That's what the US is trying to do by putting in, zero interest rates to extend the credit card cycle or the indebtedness of a lot of the sort of marginal borrowers in the US and the companies. But, honestly, if you were paying 1% interest and now you're paying zero, it's not going to move the needle for you as a business. The fact is, if you're over levered, you're going to be in trouble one way or another. And like you said, this is just one excuse to kind of tip those companies over. And in the old kind of parlance of Adam Smith, this is invisible hand of the market playing out for people who shouldn't have been doing things that they're doing anyway. So at one level, it kind of creates, assets moving into stronger hands and creating more durable kind of foundations to what eventually will be the next rise in the market. And if you're looking for that rather than looking at the screen and panicking, I think these could be really interesting times for an investor.